Good morning, good afternoon, and good evening, everyone. Thank you so much for joining us for this virtual Stockholm World Water Week session on activating the market for menstrual health. My name is Lisa Schechtman. I am the Senior Strategic Engagement Advisor for USAID's Center for Water Security, Sanitation, and Hygiene. I'm also our Gender and Inclusive Development Advisor and a very passionate champion of menstrual health and hygiene. My pronouns are she and her, and I have the honor of moderating today's session. So we'll just start off by, I'll say a few words about how USAID is viewing menstrual health and hygiene, or MHH. But then what we really want to do is spend time today hearing from our amazing partners in Western Kenya about the work that they're doing on holistic menstrual hygiene market work, really developing that market and responding to the need for access to safe, high quality, and affordable menstrual hygiene products in a local market that makes sense for the local communities. So access to safe menstrual hygiene products is hopefully, as all of us here know, essential for the physical and mental health of menstruators worldwide. In Kenya and in other countries, there are many barriers to accessing these products. Even in the United States, where I live, these products can be completely unaffordable and out of reach for many marginalized groups and people in vulnerable situations. Addressing the gap in access requires development and utilization of markets through community awareness, private sector engagement, and collaboration with local actors. USAID takes a multi-dimensional approach to menstrual health and hygiene, and we really recognize that it's essential to advancing women's empowerment, gender equality, and human rights, and to achieving both SDG 3 on health and SDG 5 on gender equality. But MHH is also a really big component of the United States Global Water Strategy, which is a whole of government approach to addressing improved access to safe drinking water, sanitation, and hygiene, improved systems, governance, financing, institutional capacity and markets, and protecting freshwater ecosystems. While we do have MHH as a part of our focus on equity under the Global Water Strategy, we recognize that WASH interventions are only a part of the solution to a much broader challenge. USAID teams focused on education, sexual and reproductive health, maternal, newborn, and child health, positive youth engagement, and other areas also make their own investments in menstrual health and hygiene. And last year alone, USAID invested more than $10 million in menstrual health and hygiene initiatives around the world, both in development and humanitarian contexts. USAID's Bureau for Humanitarian Assistance also puts a huge emphasis on MHH as part of its emergency response activities. And during 2023, USAID emergency response programs provided almost 30 million people with WASH relief supplies that included menstrual health products. I recently had the privilege of visiting our Western Kenya sanitation project, which we'll hear more about in the next hour or so. And it was just one of the coolest visits I've ever had. This is some of the most sophisticated MHH work that USAID is supporting anywhere in the world in terms of its approach to market development from both the supply side and the demand side. This work draws on years of work on market-based sanitation, but it also brings in really deep experience with gender initiatives to really create a new approach to developing a market in combination with social and behavior change and gender norms work that allows that market to grow. WKSP is also an exemplary program for its intentional approach to working with at-risk individuals, such as adolescent mothers, to increase their agency, empowerment, and bargaining power. This type of targeting is prioritized in the global water strategy as operating principle number 2, which demands that all of our work on water and sanitation make intentional efforts to close equity gaps and to reach those who are most at risk of being left behind. Many USAID missions, in addition to Kenya, are also increasingly looking at achieving gender-related outcomes in addition to WASH outcomes in bilateral investments. I hope the lessons and successes we'll hear about during this session will spur ongoing discussions in the broader global community about ways we can collectively improve menstrual health product access while also changing and challenging gender norms and driving improved life outcomes for all people who menstruate. I'm going to now turn it over to our panel. They are the real experts. Before I do that, I just want to let everybody know that we will save time for questions and discussion at the end. So as you hear the presentations, please feel free to drop your questions into the chat, and we'll have an opportunity to look at those after the slides and our presentations finish. I'll introduce all 4 speakers at once just to save the time. And I will look to them to move on to the next speaker as their respective slides come up. So we'll start out by hearing from Faith Masika, who is the Menstrual Health and Hygiene Officer for the Western Kenya Sanitation Project. And then we will move to a speaker from the Society for Empowerment Project. I believe it will be Festus Juma. Following that, Dan Obota, the project coordinator of the Red Pride Project at Machibabu Foundation, will share some thoughts and lessons. And then finally, we'll hear from Joyce Nabalayo, Business Development Service Coach with LaComp. So you are not here to hear from me. So I will stop speaking and invite Faith to come on and take it away. Thanks, everyone.
Yes, thank you so much, Lisa. Good morning, good afternoon, good evening. My name is Faith Masika, and I'll be presenting on activating the market for menstrual products and services through social behavior change campaigns, the case for USAID Western Kenya Sanitation Project. I will give a brief introduction to our project. USAID Western Kenya Sanitation Project is a 5-year project, and our goal is to create a financially sustainable, transformative, replicable, and locally owned menstrual hygiene management marketplace in Western Kenya. For us, we use menstrual hygiene management for purposes of implementation, and menstrual hygiene management is covered in our Objective 3, whereby our aim is to increase access to and uptake of market-based improved menstrual hygiene management products and services at the household level. And we don't work alone. We work with local organizations. We call them grantees. We work with local governments and the private sector in combating menstrual stigma and enhancing product accessibility. For our approach in market-based menstrual hygiene management, we work around 4 thematic areas. The first one being creating an enabling environment. This is where we support local governments to come up with policies and regulations that are business-friendly. We are also conducting social behavior change campaigns, providing information and education to community members. We are working to ensure that menstrual hygiene management products, services, and facilities are readily available. And this is whereby we are implementing a market-based approach. And for us, our market-based approach seeks to stimulate the private sector to increase supply and the demand for menstrual hygiene management products and services, while working with the government to create the enabling environment for business. And lastly, we are keen to have MHM research and learning embedded as part of our project for purposes of continuous collaboration, learning, and adaptation. So as we are implementing our social behavior change campaigns, Our objective for the social behavior change campaigns in menstrual hygiene management is one, to break the silence through increased awareness to everyone in the society. We want to increase the number of boys, girls, women, and men, and all community members accessing correct and consistent information and education on menstrual hygiene management. And we want to have an increased number of women and girls who are able to demonstrate good menstrual practices. And for us to effect a long-lasting change, then we are keen to promote sustained stakeholder participation and support for MHM programming. And lastly is to promote proper, dignified, and environmentally safe menstrual waste management disposal practices. So as we have been conducting our social behavior change campaigns, our aim is to use the campaigns to, one, create awareness, and two, also build market for menstrual hygiene management. So we have realized enhanced awareness and attitudes. There's change of attitudes and perceptions among community members. And we've been able to reach over 475 and 23 persons with information on menstrual hygiene management. And through our local partners and the private sector, we've been able to sell menstrual products worth 20,930 USDs. And we've also been able to create employment for over 50 people within the 5 local organizations that we work with. In addition to that, we held a hackathon whereby we wanted to identify local innovations in the menstrual hygiene management space in this region. And so far we have 3 innovators in the menstrual hygiene management space. One of the innovator is going to pilot on making biodegradable sanitary towels from bagasse. And the other one is on having an innovation around menstrual waste management. And the last innovator is coming up with menstrual pad dispensers so that it can be able to enhance menstrual product accessibility to our community members. As we continue doing our social behavior change campaigns, we've been able to also spur local innovations around menstrual waste management, and communities are having their own innovations that we support them to scale and improve on them. And we have the amazing CBO group who have customized containers for collecting menstrual waste. Matibabu Foundation in Siaya have a mobile incinerator, and we have Inwadada Foundation who have a clay burning chamber. So these are some of the innovations, and there are more that we are working with community members and the other local organizations to come up with so that we are able to improve on them and scale them to other regions. And just for the close, I forgot to mention that we work in 8 counties or local governments in Western Kenya. And the local governments are Kisumu, Siaya, Bungoma, Busia, Kakamega, Migori, Homa Bay, and Kisii. Thank you so much, and I'll hand over the presentation to SEP.
Thank you so much, Faith, for this. I'm going to talk about Sule products, that is the reusable sanitary pads, and focusing on empowering communities by elevating market-based menstrual hygiene through awareness, production, and sustainability efforts. Facilitating market-based reusable menstrual pads. You said WKSP supported Society FM project in enhancing menstrual hygiene management in Homa Bay County by promoting reusable sanitary towels through community engagement and sports initiatives. SEP uses the power of sports as a tool for mobilization, hence was the entry point. The Sule market introduction strategy includes market segment analysis to identify target markets, strategies, and key stakeholders, while actively involving them in sales and awareness efforts. Then about our outreach plans, SEP utilizes a bundling sales methodology and diverse marketing channels, including social media and its network, Friends of SEP, to expand its reach, while seeking philanthropic or to fund menstrual pad donations for underserved individuals. That is how we approach the market. Then outreach strategy is with your said WKSP support, SEP has boosted Sule products production from 16 to 20 to 70 to 85 boxes daily, resulting in the daily production of 210 to 255 reusable pads and employing 10 teen mothers in the projects. Distribution channels. The organization enhances its distribution by utilizing diverse channels, including stockists, expanded markets, and collaborations with USAID WKSP's grantees for effective door-to-door marketing. SEP works in collaboration with other grantees to stock our products and help us in the selling. So our sustainability plan is SEP also prioritizes environmentally sustainability, utilizing biodegradable materials for its products, promoting waste reduction in the environment, and ensuring hygiene through proper washing practices of the reusable parts. Facilitating market-based reusable menstrual pads in terms of cost effectiveness, reusability, and cost effectiveness. Suli pads come in 3 different types. We have the large, which goes at $3, and then medium goes at $2.5, and then panty liners go at 2.5. All this come in 3 packs in a box, in a small box. Enhancing uptake. SEP is boosting brand visibility and menstrual hygiene management products usage through community sensitization, outreach, radio shows, social media, and public exhibitions. Sales made. Sales before SEP was onboarded by USAID WKC project. SEP did not focus on market-based approach. It's a new technology. It's a new approach that we got through USAID WKSP partnership. So now, since we started that, sales during USAID WKSP project to date, the reusable pads we have sold a total of 1,563. That is between August 2023 to June 2024. And then the disposable parts that we also have from other grantees is 158. That's between September 2023 to June 2024. That is holistic sales as at June 2024. Yeah. I think up to that level, I would wish to invite Matibabu Foundation. Thank you so much.
Daniel, you're on mute.
Thank you so much, Festus, for your presentation. Good morning, good afternoon, good evening for everyone here. I'm Dan Ogota from Matibabu Foundation. We are implementing Border Girl through driving community awareness by delivering menstrual health management information effectively. Border Girl are just girls who are trained to be motorcycle drivers. So in our community, 90%, majority of our community uses motorbikes as a means of transport. So the Border Girls are introduced to provide transport to community through the motorcycle. Yes. Now the Border Girls are conducting a demand creation where we've engaged 26,933 community members through information campaign, home visits, group meetings, market activation, and mail dialogue forums to raise menstrual hygiene awareness. We also deploy digital app where we are reaching the community with the right information through digital app, the use of Red Pride digital app. So far, we've managed to register 474 active users. 125 were newly registered for this year. 75 community members have managed to order their products through the digital app. 97 community members have managed to request for expert advice, and our team are linking them to the relevant health facilities for further management. Through the rides, as I said, the girls are conducting rides. So as they conduct the rides, they start the conversation about menstrual hygiene, breaking the silence. So far, the girls are conducting 100 rides per day, breaking the silence on MHM. Then the girls are also supporting us in distribution of sanitary pads at the doorstep. So far, we've distributed 4,950 sanitary pads, 4,936 disposable, while 14 are reusable. These are packets of sanitary pads that we are distributing to the community. The girls are also helping us in menstrual waste management. So far, the project have installed 4 low-cost incinerators in the community. This, we've created full-time employment to 7 community members and managed to burn 0.089 metric tons of waste. We have the business model that's come from the initiative that we're doing. The girls, border girls, earn an average of $10 per day. This is helping them to support, improve the lives of their children. We remember that the girls are adolescent mothers. So the money they collect here is also bringing hopes to the 18 children of these girls who are hopeless. We have 21 women-led enterprises that we are engaging in selling of the products. The organization is also supporting a safe space that has increased their revenue from $40 to $130 per month. Yes, I'll now hand over to Joyce Nabalai.
Joyce, you're on mute as well.
Mhm.
Go ahead, Joyce.
Okay, good afternoon to you all, and sorry for the hitch. My name is Joyce Nabalayo, and I'm representing LACOMP this afternoon. And basically, I'll be talking about unlocking private capital to sanitation and menstrual hygiene management enterprises. After realizing that most of the enterprises were going through a few challenges in the market, like limited access to finance and weak business skills, and also lower consumer awareness, LACOMP, in collaboration with WKSP, came up to assist the enterprises in offering BDS coaching sessions, which is the Business Development Services coaching sessions to the MHM enterprises in the rural parts of the 8 counties that are involved in this project. And what really happens is that LACOMP maps out the enterprises and carries out a needs assessment and a baseline survey to the enterprises, which informs on the type of coaching to be offered at the individual enterprises, and also the gaps to be closed. So after the baseline and the needs assessment is carried out, PIPs are formulated, that is the performance improvement plans for each enterprise is formulated, and the key performance indicators are also formulated to assist in closing the gaps that might be affecting the enterprises in the rural parts of Kenya. After which the coaching sessions will then begin, and by closing the gaps that have been identified in the specific enterprises. And As a result of this, a lot of achievements have been realized in terms of empowerment to the enterprises, in terms of improvement in sales turnover, and also in investment. So for the period that we have been in collaboration with WKSP, 144 rural enterprises have been supported by enhancing their bankability through business advisory, plan development, financial management, and business soft skills which has been taught to the enterprises in the rural parts. Then a new capital of 142,000 USD has also been realized in the enterprises as new capital, and it has already been disbursed to the rural MHM enterprises through the B2B linkages, which is the business-to-business linkages with the local banks. And also as a result of coaching of the rural enterprises have, through the coaching, the rural enterprises have realized a sale of 10,836 sanitation and MHM products, which has boosted the sales turnover of the enterprises. I thank you.
Thank you so much to everyone. And I'd like to invite our panelists to all come back on screen so we can hopefully have a bit of a discussion together. I think it's really great that you've all been able to kind of give us a description of how you each play a role in a more holistic MH market initiative, from the business development training to the incinerators, which are in fact small businesses themselves, to employing adolescent mothers who are very vulnerable in giving them jobs in producing pads that enter the market, and selling pads, allowing the Boda girls to make a living. I think this statistic about how much the Boda girls' income has increased with this training is really powerful to me. So I have seen some questions coming into the chat. I invite people to continue adding them. But I would just like to start by asking all of the panelists what the most surprising thing you've learned has been as you've switched to this market-based approach to promote menstrual health products and services. So maybe I'll go in the same order that we went in for the presentations and start with Faith.
Yes, thank you, Lisa. What I've learned in implementing a market-based approach to menstrual hygiene management is that, first of all, the menstrual hygiene management market is still nascent. So we are still growing that market. And number two is that every stakeholder has a key role to play. And this requires all the stakeholders to work together in synergy and in complementarity. And the private sector plays a crucial role in driving the market, but other stakeholders like government, local organizations are there to facilitate the process for the private sector to thrive. Yes.
Thank you, Faith. And it's great that you mentioned local government. That's, we don't have local government represented in the same way on the panel, but it is, they are a huge piece of this partnership. Festus, I know that you have been very kind to fill in for colleagues at the last minute, and hopefully you're still with us. But I'd like to hear from you as well. What's been the most surprising thing you've learned? Maybe I'll move to Dan just while we check to see if Festus is still in the call. Dan, how about you?
Thank you so much. What I've learned on a market-based approach that we are implementing is how it has led to improvement of lives in our community. And through the market-based approach, the children of these Boda girls, their lives are improving daily. The border girl can attest that they can't miss a meal, which is the most important thing. And now the border girls can also afford to pay school fees for their children, something that was not there before the market-based. So when we introduce the market-based approach, there we are getting revenue that are able to change the life of community members. Thank you so much.
Yeah, I think that's hugely important. It's very easy for us to focus on how many things we've distributed, but it's helpful to remember that we're actually doing it in order for people to have better lives. So thank you for reminding us of that. I think we have Festus back.
Unmute. Now, can you hear me now? Can you hear me?
Yes, please go ahead.
Good. Thank you so much. Sorry that I could not unmute then. We have learned a lot at SEP because we realized that there's a real synergy working with other partners in creating awareness around access and uptake of reusable sanitary pads. And there's a lot of education that, if well done, that we are achieving our goals of even having the male involvement by way of sensitization and having them being part of getting the solution to this. Addressing issues around shame calls for concerted efforts of community members, gatekeepers, and even other grantees. Then you can work together in this. In terms of market-based approach, we realized again as SEP that working in collaboration with other institutions, especially fellow grantees, enhances and widens our market base. Thereby, we can really realize improved sales of the product. And this is something that we really want to emphasize on, that we need to work in collaboration with our institutions to improve on sales and access of these products. Thank you.
Thank you, Festus. And thank you for mentioning the importance of engaging men. I will say we have a comment in the chat. It's not a question, but I think it's worth saying out loud that it's been pointed out that many of the leaders in this partnership are men, and how critically important that is to breaking stigma. So special shout out to Dana and Festus and others on the project team who are modeling to their fellow men that this is an important issue. Joyce, coming to you, what has been most surprising for you?
Okay, I'll speak from the community level. I say that what's so fascinating and so unique to me, something that I've actually been able to note for a period of like 2 years now, is that initially matters MHM were mainly taken to be a women's issue. But right now we are able to see persons like Festus and Dan even taking part in this process, and they are able to actually sensitize the community. And Lisa, you should see them demonstrating with the reusable sanitary towels in the community. So to me, it is something that is so interesting, and I can say that the community is slowly embracing the market-based approach. I thank you.
Thank you. And I just for everybody to know, we've been joined by another man who's leading in the space, Neville from the project team. Neville, did you want to add anything to this question before we go to the chat box questions?
Thank you so much, Lisa. And thank you for what my colleagues have already mentioned. I think for me, one of the most fundamental things that I've learned, we were coming into this foray thinking that we are implementing just something that is so obvious and straightforward, only to learn that first and foremost, we have issues of menstruation that is a taboo topic. Then added to that taboo topic that you're not supposed to talk about, it's a mystery in itself. You add another animal called market-based approach, and yet we are used to the traditional ways of doing things whereby we just distribute sanitary pads. And it has been more of trial here and there, trying one thing, failing and going to the other. But to me, the greatest learning that I've gotten from all these is the role that communities play, especially in matters of menstrual health and hygiene. We might most of the innovations that we've piloted are mainly from communities. They might be so rudimentary, but that is our role now to see how we can scale them up. So to me, the greatest learning is moving matters of MHM from the boardroom right to the community is of great importance.
Thank you. I'm gonna take a couple questions from the chat. And we have a few about the products mix and your experience with the products. So one question is asking whether any of you has tried introducing menstrual cups, discs, or reusable period panties. And then we also had a question about biodegradable pads and whether any of you has experience with those, whether your enterprises are using them, any demand from the communities that you might speak to.
I think I may want to go first. Oh, I'm spoiling. Am I spoiling the program?
Please, it's an open discussion. Go ahead, Festus.
Okay, I thought Faith would go. Now, fine. SEP has tried both menstrual cups and the period panties, reusable period panties, and we have different experiences of both. For one, the menstrual cup, based on our target population, SEP is based in a totally rural setup, and many young people do not understand the menstrual cups. So for the first time that we introduced this, we got some kind of resistance from most of the girls, because being that it's plastic and it has been inserted, the girls had a perception that the menstrual cups would break their virginity. And you see, that would be a myth from the community, and therefore they really resisted that. With that is when we move to reusable period panties. The period panties work so well. It reduces shame and stigma because you can wash them and just air them publicly. This was highly accepted through our soccer girls. SEP uses football, as I said, and therefore our soccer girls felt very comfortable using the period panties. We had to move up from period panties because we felt that the pants themselves were not manufactured by SEP. So it wasn't our own innovation. That's why we moved, therefore, to reusable sanitary pads that are standalone and we can manufacture ourselves. Otherwise, it has worked well. Period panties work well, I can confirm. The reusable cups, for the few who accepted and the few trying them to date and the few using them to date, say they're very comfortable, they're very good. And when we go for the demonstrations, the community dialogues, community engagements, I see change of perception of people coming back to accept menstrual cups. So they're working well. Thank you.
Thank you, Festus.
I can add on to what Festus has just mentioned. So there's a lot of misconception in our community members with regards to reusable menstrual products. This is because of the belief that some of our community members hold that menstrual blood is dirty, it's not something that should not be seen, it's impure. And so people have, let me say, people have fear around washing their own blood. And this has really slowed on the uptake of reusable products. Just the fear and the misconception that I cannot wash my blood. And number two, the upfront cost for also procuring reusable products is a bit expensive compared to the disposable pads. And so the uptake of reusable products is still slow, considering that most of the communities we serve are of a low socioeconomic status. And as Festus rightly mentioned about community members fearing using menstrual cups because it will break their virginity. And also, the availability of this product has not been constant in this region. There are very few companies who are making reusable pads. Like for this region, we only have SEP that has reusable pads that have been certified by the Kenya Bureau of Standards. Most of the other manufacturers are still struggling to have their products certified, and as a project, we are working to support them so that we also increase the availability of these products locally. because sometimes community members might really want to use them, but they are not readily available. And so ours is one, to create awareness as a project on the various types of menstrual products to make communities make an informed product choice. And number two, to work with the various manufacturers to increase product availability within the region. Yeah, thank you, and back to you, Lisa.
Thank you, Faith. Would anyone else like to comment on this? We can move on to a couple of questions about the incinerators, if not. And everyone, do continue to add questions in the chat if you have. So we have two questions about the incinerators, which I think is something that we don't talk about very much in the global MHH community, that, you know, this can produce a lot of waste. The more access we increase and the more menstruators who choose disposable products, the more waste is produced, and finding solutions to that is really important. And I think SEP and others have had great success in following the lead of the communities in coming up with innovative business models, small business models to address this. So we have two questions about that. The first is related to the mud-based incinerator. How do you control the temperature and the release of toxins? And then the second is a broader question about the incinerators. Are they all built in Kenya? And have there been assessments done yet on operations and maintenance costs and the feasibility of scaling them up? Now, I know these are pretty small, innovative programs that are happening at the very local level, but it would be great to hear if you have thoughts about controlling toxin release and also potential for scale up.
Yes, I think I will give it a try. Starting with the clay burning chamber. I'm happy that someone has baptized them mud incinerators. So the clay burning chambers are a local innovation. We are trying to support households be able to manage menstrual waste within their vicinity, and it is a trial in the first place. So one, we are not yet to a level whereby we can talk of controlling exposure to the toxins, but our encouragement has been that the waste be burned at night or late in the evening when there is less movement, so that people are less exposed to the fumes that will emanate from burning the waste. And number two, as a project, we are working now to improve on that innovation so that it meets the standards of an environmentally friendly innovation. The other incinerator, the one that Matibabu have in Siaya, it's a low-cost incinerator. Yes, they are sold by a local company in Kenya, but they are not made in Kenya locally. Some of the parts are imported from other countries, but they are locally assembled in this country. Yeah, I think, I don't know whether Neville might have some additions to the innovations on menstrual waste.
Yes, maybe what I can add, actually the mud incinerator existed before. It is something that for a very long time, communities within where we work in have been using it to warm their house when it's cold. Then here comes a case, the communities out of their brainstorming sessions one time decide, why don't we try this to burn menstrual waste? And at one point we were also a bit skeptical because we thought maybe they would need to use some fuel like petrol, paraffin, kerosene for that matter, to ignite the waste. But surprisingly, it burnt slowly until the only thing that was remaining was ashes. Now, as Faith has already mentioned, the onus is on our end. How do we improve this particular innovation to make it friendly to the environment. And the challenge that we've been having is looking at some of these innovations, however nascent they might be, at least they're affordable to the community. When you look at what is normally propagated as the most ideal method of waste disposal within the country using non-burn technologies, we only have about 12 in Kenya. So meaning that you have to collect your waste to get to these 12 areas spread within different parts in the country, which is also expensive. And for us, we were looking at what is it that is available and also accessible to these communities, but also affordable to them that they're able to use at any given time. So that is why we thought it wise. Why don't we look at those innovations that they are community friendly, then as we also engage with the communities and also the innovators, we are able to scale them and make them more adaptable. And apart from that, we are also in the process of undertaking a study on methane abatement, which will also inform how we are going to deal with the fumes that are that emanate from these waste. Yeah.
Thank you. And Neville, have you gotten to the point yet of looking at the operations and maintenance cost and scale up options for the various incinerators?
Yes, because one of the things that we were looking at while trying to recommend some of the innovations that can be adopted within the household setting was operation and maintenance, but also at the same time, the initial costs of maybe having them. And apart from that, we are also working closely. We have a civil engineer within the project who's also been advising on one, how we can increase the temperatures so that everything is burnt at a go, and how we can also have large scale ethane incinerators or other burning chambers that are also environmentally friendly, but can be adopted within the school setting. So those are some of the things that we've been considering. Yeah.
Thank you. So we have about 10 minutes left and a couple more questions to get to. The next one is specifically
Can I
for...
catch it?
Oh, please, Festus, go ahead.
Thank you. I just wanted to add some voice to what is going on in this discussion. Very interesting. I'm borrowing just briefly from what both Faith and Neville are explaining with regards to the locally innovative ideas, especially the clay system of burning the pads. And I think building from that clay thing, I should confirm that we as SEP have been trying something that is more of airtight carbonization process that should be able to abate any form of methane. So then, because of the carbonization process, the byproduct in that process itself can be used again to produce something that the community can be able to use, like a circular economy kind of approach through the menstrual waste, and therefore it is something that is at the third iteration. It can work. We are trying it slowly, and I hope soon Neville can visit and we discuss together what is working through carbonization approach.
I love it. I think we just witnessed innovation in real time.
Yeah.
Thank you, Festus.
Yeah.
Joyce, we had one clarifying question for you. Do you know what's the ratio of women to men in the enterprises that you're supporting?
Okay, thank you for the question, Lisa. I can say that the ratio is 1:4. That is 1 female to 4 male. And mostly the challenge behind this is the startup capital. Most female entrepreneurs are not able to access the startup capital. But we are trying to address this issue by forming investment clubs, and we are making sure that more female entrepreneurs are joining in these clubs. Thank you.
That's great. Thank you. That actually ties really well to one of the other questions that we've received. Have there been any efforts to facilitate microfinance loans from MFIs for some of the smaller enterprises to increase production or sales? How is the financing coming for all of you who are leading these small enterprises?
Maybe I can take that. So one of the challenges that we had while starting off was looking at issues of how do we ensure that the enterprises that we work with are actually able to are one, bankable, and also able to access finance. And here comes a case whereby some of them, the products that they're selling, it will mean that the kind of financial package that they will request will be some small tickets, which to the bank were not sustainable. So yeah, then it meant that we have to look at some other alternatives and sources of funding. And one of the things that we did through our access to finance component was also to look at how can we speak to the banks so that the banks can understand what we do. Then the banks are able to look at mechanisms in which they are able to ensure that they have eased the regulations that they have for some of these enterprises to request for some funding. And we did that, and through that, some enterprises have already gotten some funding. I know there are some enterprises that have already gotten funding for sanitation, and the same enterprise, one enterprise that is implementing sanitation has also lodged requesting for some funding so that they're also able to scale their sale of menstrual products business. So it's a bit challenging, but at least based on the work that we do, others are also understanding now what is happening. Then another financier that we never saw the need of neglecting was the national and county governments. And through our efforts, the county government, for instance, the county government of Busia was able to allocate Kenya shillings about 5 million purely for matters of menstrual health and hygiene for the last financial year, and also increased it for this particular financial year. So at least through those efforts, we are able to look at what are some of the public and also private financing that we have. And maybe lastly, we normally have women groups, and these women groups have their merry-go-rounds. Someone was surprised recently that there are merry-go-rounds specifically for ads, that there are women groups who meet in the same way that you'll meet for big projects. There are women groups who meet, and what they ensure is they have some money that they can loan to members specifically for the purchase of menstrual products. Yeah.
Thank you, Neville. In our last few minutes, I want to go back to a couple of additional questions on the reusable pads themselves, and specifically about how the projects are making sure that the women and girls using those pads are able to do so safely, both in terms of their physical and their psychosocial well-being. So the first of these two questions is about the need to dry reusable pads after washing them, and that link to stigma that has already been discussed. What kinds of solutions have you all been able to find in terms of supporting women and girls to be able to dry their pads in the sun, even though that means they might be seen? And then the second question, which I think is a very, very common one, is whether there is a link between the ability to use and maintain reusable products and the availability of water. So let's maybe start with the options for drying the pads, and then go to the links with availability of water. Faith, I saw you nodding. I feel like you have something to say.
Yes, thank you so much, Lisa. Sorry that I have a flu. My voice might not be so clear. So on maintaining the hygiene standards of the reusable pads. So as I started, is that we are conducting social behavior change campaigns to build the market for menstrual products. And so we have a robust social behavior change strategy that we are using to conduct our social behavior change campaigns. And our first two objectives focus on creating awareness. First of all, to break the silence on menstruation, demystify myths and taboos. And number two, also awareness on the various types of menstrual products, so that communities are able to understand the advantage and the disadvantage of each product. And so we do comprehensive awareness creation or education on reusable pads, how they should be washed, how they should be dried, and also how they should be stored after use of every cycle. And so our approach is comprehensive, focusing on making sure that the user understands how to properly maintain that product. And because of the rigorous campaigns that we have done, then the stigma and the taboo is reducing. And so we encourage our menstruators to hang the reusable pads in the sun where they should be able to dry. So with the reduced stigma in the community, then it becomes easy to really hang them in the sun to dry. But at the same time, for those who still afraid, because it takes time to really change a culture, we encourage them to hang them in the sun and put a light cloth like a handkerchief, just to allow sun to penetrate, but also for other people maybe not to to have a look at them. Yeah.
Thank you. Yeah, changing this type of stigma takes time. And in the meantime, we still want people to be able to use these products. So that's great. Dan, from the perspective of Mati Babu, I know you're providing lots of different types of services to adolescents all at once. Do you have any observations about this proper drying of menstrual pads or the impact of water access in your community on whether people are able to use reusable products?
Okay, the stigma that was there in issue of drying was being attached to male. The female counterparts feared that the male, what will the males say when they see the product being hung on a clothesline? But now what Matibabu is doing is engaging male. We have male involvement where we bring male together. We discuss, we sensitize them on how to support female in matters of acquiring and even managing their menstrual. So as we bring men together during male dialogue forums, we discuss this and we urge them to support female. So that fear is shedding off. And now, because men knows that their female counterpart need to use the reusable and hang them. So this is shedding off the fear. Thank you.
Thank you. That's what we hope will happen. Mark is giving me a cue that we only have 2 minutes left. And so I'd like to ask each of you in one sentence as we close out, thinking about the work that you are doing and the community members that you are working with. What is the one thing that you are the most proud of from this work? Festus, can I start with you?
Can you repeat the question?
What is the one thing that makes you the most proud from this work that you?
Great. The niche, or one thing that makes me happy, is that we are able to come up with innovative reusable pads that hugely reduces environmental waste that is coming as a result of disposable pads. We minimize the disposability of pads, and that makes us very sensitive about environment. This makes me so proud.
That's a great answer. That's a great answer. Joyce, how about you?
I can say that I'm so proud because the women are able to take part in these community initiatives, unlike it was before, and they are able to take part in decisions that affect their lives and the people that they live with in their homestead. Yes.
Okay. I also love that answer. Dan, what is the thing you are the most proud of from this work?
And thank you so much. What I'm proud of is the fact that the blood, the menses that used to be a taboo in our community, people not used to talk about it. And right now, the project is changing that narrative, and the same blood, it is becoming a beacon of hope to those border girls and their children and orphans in the community. Orphans can now go to school because of the same blood that we used not to talk about. So the project has changed that narrative, and that is what makes me proud in the community. Thank you so much.
Faith. And then we'll go to Neville. We are out of time, so we will be quick and very proud. Faith.
Yes, thank you, Lisa. I'm proud that we have moved the menstrual hygiene management discussions from the boardroom to the community, and communities are now taking charge in discussing issues around menstrual hygiene management. In this Western region, I think we have over 800 community groups that are currently discussing issues with the menstrual hygiene management.
That's amazing. Joyce, have I come to you yet?
Yes, I have.
Okay, then I think Neville has the last word.
Thank you so much, Lisa. I think I'll just want to echo what my colleagues have said, that for the first time, I feel like communities have been empowered to interrogate, one, their culture, gender, and social norms related to matters of menstruation. And right now, people are beginning to speak and using also matters of menstruation and menstrual management as an entry point to discussing broader issues such as family planning, reproductive health, and others. And to me, that is a big plus, just understanding our bodies and able to discuss it openly.
Amazing. Thank you. Well, let's, for those who have the ability, give a virtual round of applause to our panelists. And thank you everyone for joining. This was a great discussion and hopefully just the first of many conversations about market development for menstrual health and hygiene. I hope everyone has a wonderful afternoon and evening wherever in the world you are. Thank you.